Dear learners, welcome back again in our today's session. So as you can see that in the slide, our today's topic is auditory processing disorder. It is known as APD. So first, let's understand the meaning of auditory processing disorder, APD. So basically, APD, auditory processing disorder, is a condition that affects the brain process sound and speech. It is not a hearing problem, but rather a difficulty with interpreting and understanding the sounds, the message. For example, a child who is suffering from APD might have a trouble understanding their teacher's instructions in a noisy classroom, even though their hearing is normal. They might hear the words, but the brain has trouble making the sense of them, leading to difficulties with the following direction, paying attention and learning. This can be frustrating. So now next we are going to understand about the symptoms of APD. Here we have mentioned few symptoms of APD. So the first one is difficulty in understanding speech. The students who is facing the problem of APD, especially in a noisy environment or when there are multiple speakers, the student face the difficulty to understand the speeches and the meaning. The second one is frequent misunderstanding, often asking people to repeat themselves. The third one is problems with following direction. The students who are facing the APD problem face the difficulty in following the complex instructions, especially if they are given verbally. The next one is difficulty with reading and spelling. Since auditory processing is linked to the phonological processing of too, issues in these areas are very common. The next one is academic challenges. They face the struggle with the subjects that heavily rely on the listening and understanding on verbal information. So now next we are going to discuss about the causes. What are the basic causes of APD? The exact causes of APD is often unknown, but we have categorized few causes. So the first one is ear infection. If the students have an ear infection, it can be the cause of APD. And the second one is head injuries. If the students, if the person have a head injuries in the past, it also can be the causes of APD. And the third one is neurological condition. And the last one is genetic factor, also the causes of APD. Now, next we are going to discuss about here diagnosis, how we will find out the problem. So, if you are going to diagnose, the APD involves a series of tests conducted by an audiologist. These tests are assess various auditory skills such as auditory discrimination, auditory memory, sequencing and integration. These are the tests to find out, to diagnose the APD problem in students. Now next we are going to discuss about the strategies for coping with APD. What type of strategies you can follow for their students. The first one is environmental modification. Using a FM system in a classroom to reduce the background noise and enhance the teacher's voice. The second one is auditory training programs. Exercises and activities designed to improve the specific auditory processing skills. To conduct the training programs too. And the next one is language therapy. Working with speech language therapists to develop the language and communication skill. And the next one is classroom strategies. Implementing a specific teaching strategies to aid learning, such as providing written instructions to complement verbal ones. And the next one is minimizing background noise, creating a quiet listening environment. And the next one is repeat and rephrase, repeating the instructions or rephrasing them if not understood initially. And the last one is check for understanding, asking the individuals to repeat back instructions to ensure they were understood or not. So overall, by understanding and addressing the unique challenges faced by individuals with APD, it is possible to help them achieve their full potential and improve their quality of life. Thank you.